organisationally, I guess I'd just say that being kind of adaptable and flexible enough to move our model into a remote support model has meant that we've continued to deliver kind of really vital support to older people at a time when they need us the most. Another way in which people have lost access is some older people we work with relied on technology through friends and family, and this became more difficult when they were less able to see their friends and family.
We've seen the need. There is a real need for people who previously haven't been interested in being online, couldn't afford to be online, whatever reason. They've seen that there is now this need and a use for being online, but it is a real challenge to be able to help people when we're trying to do it all remotely, and we're doing it with technology that is brand new to them.
We had somebody that was really reluctant, and a lot of older people are, to be honest, and if they get offered a device, quite often they will say no. So it is that extra layer of support that's needed for older people to encourage them to have a try, and that's what this digital project has done. It's meant that even throughout COVID, that people are connected to family, to support services, to their local shopping, that they can do these things independently.
Luckily, most people have my phone. I've been using it since probably 2003 or 4. So I've never changed my number. So everyone who knows just picks up the phone or text. So I ended up saying to people, just text me, I'll get back to you.
Okay, thanks everyone. That really was a snapshot of some of the key messages that we want to reinforce today. I can see that the Q&A is starting to power up. So thank you for those people who put questions in the Q&A. I would encourage anyone else to do so. And thank you for those people that are putting the resources and saying hello to each other in the chat. Please continue to do that. Today is really about starting that dialogue. Some of the questions that are coming through on chat in terms of just why we looked at 50 to 70-year-olds. As an organisation, in terms of aging better, we're particularly looking at that age cohort because that's where you can make, I think, a lot of interventions in that age range in terms of preparing for a better later life. And digital connectivity is actually an important element now in terms of what you can do now in terms of preparing for greater digital connectivity and digital inclusion later on. Just a bit of context about the research. We commissioned Citizens Online, and James Beecher is presenting from them today in a moment, to look at this whole area with regards to the impact of COVID. As an organisation, we're very concerned about the impact of the pandemic on a number of areas, and digital inclusion is such a key topic. And so we were looking at the experiences of individuals aged between 50 and 70, and the organisations that supported them during that period. And today's research is really a reflection of that insight over the autumn and early part of January and February when we conducted the research. What I'd like to do now is just pass into some of the key messages, which were on the video, but I just want to sort of reinforce these because this is the real sort of key areas that we want people to take away. Firstly, there is that significant digital divide amongst the 50 to 70-year-olds exacerbated by the pandemic. In terms of the ONS research, then the ONS research from 2020 said that 32% of those who had never or not recently used the internet were aged between 50 and 69, which is estimated at over 1 million individuals. So this issue is not going to go away. It's something that needs to be addressed, and to understand the reasons why people aren't online in terms of affordability, skills, poor access, or just the ability to connect in with the local organisation. So that's the most significant area. Secondly, digital inclusion. We often talk about that these days. It's not just about being online. It is also about building skills and confidence. And I hope today from the panel session and from the video, and please, as I said, download the reports, you can see that we've looked at this whole issue about people wanting to build their skills and confidence, and really the ability to join a local group, obviously online during the pandemic, but obviously moving maybe back towards a hybrid model now, where you're able to join a group and then start to build those key skills, those real hooks in terms of what do you want to do today, what do you want to address, what would you like to do more of, and show that the world is about opening up, and it's not this. So digital is not just about the language of IT and computing, it's more about connecting with friends, family, connecting in with local services. Thirdly, local and national organisations had to adapt to continue to support users. You'll be able to see more case studies within the reports, but we wanted to show was the tremendous flexibility and adaptation made by many organisations, and many organisations are hyper-local and local in terms of community groups and people in specific geographies. And again, today is about how we can help people, I think, provide that network so we can all share best practice and best tips. Overall, though, there is that lack of awareness amongst older adults of the support that is available. This is often the case, and it's ways in which we can help promote the awareness of local organisations. I think some cases it's more about do I qualify? Am I eligible? There's a certain sort of unease, and often the case, what needs to happen is there needs to be a lot of printed material in order to advertise groups that are available and how you can join those. Organisations need more financial and peer support in building digital inclusion. This goes without saying, really, that because, as I said, most organisations that we've spoken to and I think are active in the field do need to get that peer support in terms of shared resources and more financial support, maybe through national and local government and other grants. It's a tremendous activity that's gone on out there, and we do want to ensure that these organisations survive. And obviously, I think through the pandemic, can prepare perhaps new ways of working in both maybe a face-to-face and an online environment if resources are available. Remote support has benefits beyond the pandemic, beyond the role played in the pandemic. Again, I think we've all learned tremendously about how using Zoom, Teams, online platforms actually provides a degree of convenience, and people don't have to travel. So that if they are set up and they're happy, then you could connect with more people, and you could connect at times which are perhaps more suitable to many individuals. So it'd be very interesting to hear people's thoughts today. And I know there's been some questions already in the material that when people registered about the future. I'd like to perhaps touch upon that in the panel. And then finally, as was reflected in the video, non-digital channels still need to be made available. It's always going to be the case that there'll need to be non-digital channels for a number of different reasons. And it's really, I think, emphasizing that to organizations, corporates, businesses, governments, that non-digital channels, particularly telephone, need to be made available to people. And as I said, in terms of increasing that awareness, then I do think if we can emphasize the role of just simple printed material that can go through the door or be put onto a shop notice board, that's extremely important in terms of way forward. But I'll stop now and pass across to James, who'll be able to go through a lot of that in more detail and show you some very interesting visuals and snapshots from our reports. Over to you, James.
Thanks, John. Hi, everyone. Yes, I'm James Beecher. I'm Research Manager at Citizens Online. We're a digital skills and inclusion charity that's been working in communities around the UK for the last 20 years. As John said, I'm just going to take you through some of the key findings. John's already mentioned that ONS data shows that there are about 3 million people who were offline, who'd never used the internet or not used it in the last 3 months at the beginning of 2020. And of those people, around a third are people who are aged 50 to 69. It's important to put a big caveat on this at the beginning. That's a third of the people who are offline. It's not to say that a third of people aged 50 to 69 are offline. Actually, of the whole age group, only about 1 in 10, which is still a significant number, but only about 1 in 10 50 to 70-year-olds are offline. That's an important caveat because as someone who's not in that age group myself, I think it's really important that we acknowledge that it's that generation that developed the internet and brought computing into everyday use, and people in that age group can feel that it's patronising or just plain wrong to assume that everyone in that age group is incapable, and that's an important insight when we're thinking about how we're marketing to people in that group in ways that we don't want to put them off engaging with support. But also it's important in terms of the opportunity that there is in terms of the provision of peer support from people that are in that age group and are confident internet users themselves. Because we know that age alone isn't the only indicator of risk, of reasons why someone's more likely to be offline, and because we're interested for this research in people who are offline or digitally excluded for other reasons, we decided to focus the nationally representative telephone poll that we did as part of the research on people who are living on lower household incomes, which we know is another risk factor for digital exclusion. So that's people under £25,000 of their household a year. And we found that in that segment of the age group, a much higher proportion were not using the internet before the pandemic, 27% in total. And to our surprise, really, we've heard a lot about people using the internet more during the pandemic, and of course that has happened. But what we found is that a lot of that, this matches up with research from others, a lot of that has been people who were using the internet before the pandemic. They might not have been using it much, but they've extended the range of things they were doing. Of people who were not using the internet beforehand, we only found 1% of respondents who were people who were not using the internet beforehand and started using it due to the pandemic, and only 3% who were using it rarely and started to use it a lot more. So it's only around 1 in 8 of those who were not using the internet much before the pandemic who've shifted. There's also worth saying, just that block at the top, 70% of people who use the internet and were using it before the coronavirus pandemic, not all of them have got full confidence doing the range of things they've been asked to do. So even within that group, their experience of digital exclusion when you're coming across being asked to do new things like register for your GP appointments online and things like that. And just to emphasize this point that the pandemic hasn't always been a prompt, that digital exclusion as a problem hasn't been solved during the last 18 months. Over half of those that we contacted by phone who were not internet users said they didn't use the internet because they didn't feel a need to, or it's not for me. And this was research being conducted in November, so during the second period of lockdown. So we can really see that the pandemic wasn't pushing people into needing to in all cases if they weren't using the internet already. As John mentioned, a big part of the reason why people don't seek support, whether they want to or not, is because they don't know where to go to. We heard this from Pat, one of the people that we speak to and is featured as a case study in the research, who said that she often needed assistance when something happened that she didn't understand, but she didn't know where to go to for help. That's someone who was using the internet for all sorts of things, but when she came across a problem like wanting to put her emails into folders, she didn't know how to do it. Another example is from Margaret, who again there's a case study on in the research, who was using computers quite a lot at work and would ring the IT people, but she couldn't do that as someone who had retired and kind of lost touch with computing as a result. She said that having somebody you could ring would be really helpful for people like her, and we do have some case studies of a lot of organisations who've provided phone support during this time. So looking at how people have done things differently, and as John said, I really want to emphasise that people have adapted really quickly, and we really should show huge appreciation for the innovative things people have done, the capacity to change under enormous pressure, and the kind of compassionate approach people have taken, and understanding that there will be people who need different forms of support. So the organisations we surveyed, which are a wide variety of organisations, lots of them already doing digital work, but a lot of them newly formed mutual aid networks and small local organisations. Around 2/3, 63% at the top of the top larger bars at the top here, had moved some of their services either online or to telephone rather than face-to-face. About half of organisations, as we go down the bars, had not been able to deliver some or all of their services because of restrictions, and I'll talk a little bit about that more in a second. Over 40% had made a venue COVID secure. Not every organisation that we surveyed would have had a venue, so that's a good proportion. And lots of organisations have trained their staff either to deliver services remotely, staff have been given digital skills training themselves, or staff have been trained in how to help others with digital skills, although that's the lowest proportion at about 32%. And we notice there's a big gap between organisations that are providing services online and those that have trained staff to help others with digital skills. That could be because those staff are already capable of doing that, so they didn't need any more training. But we suspect that there's a lot of organisations that would benefit from giving their staff additional training if they knew where to access it or if they had the resource to be able to do that. At the bottom of that chart, you've also got about 10%, just over 10% of organisations that have not been able to deliver services because of financial impacts. And the worry is that that will only grow as emergency funding runs out and the financial pressures get greater as we come out of the pandemic. Lots of organisations have been providing different forms of digital support. That's one of the things that we asked about. So on this chart, you can see in the dark blue things that people did before COVID-19 and are still doing. In the purple, things that they've started doing since COVID-19, things that people used to do but have had to stop doing, and things that in the green, and things in yellow that they've never done. So the things that organisations were most comfortable doing and continued doing were helping people to understand what they can do online, or helping people to do new things like online shopping or benefit applications. The things that really we saw a big increase in during this period is digital devices. Obviously, with people losing access to devices in libraries or other community centres, giving people devices or loaning them became really important. And over a third of the organisations that we spoke to, 34%, had set up some form of this device scheme. We also see helping people with the costs of devices or data is the thing that fewest organisations were doing at the start. And again, there's been a big proportion, of about 1 in 5, who've started doing that since the pandemic. It's important to go back to that point about helping people to do things for the first time. One of our case studies is with John Curtin from the North Manchester Community Partnership, and he reflected how a lot of learners that had been helped through this scheme in the past came back during this period because they were encountering new things that they weren't able to do, or that they didn't feel confident with, or they'd lost their confidence when they were doing things by themselves without the support of a family member or being able to ask someone. One of the things that organisations that haven't been able to provide digital support at this time have been able to do is to signpost to other organisations, and that's been particularly important for things like funding for devices and data, where, as I said, about a fifth have started to do that, which is really great. But even more importantly, of those that weren't able to do that themselves, another 2 in 5 or more have been able to signpost to another organisation to do that. Now, of course, that leaves a number of organisations that aren't able to signpost. So that's about that awareness again, not only the individuals that need support, but organisations not having an awareness of the network of offers that are out there. So I just want to talk very briefly to finish with some examples of good practice, which are covered in the research. There's lots of stuff about the digital support that organisations have provided, but a key thing is that provision of support through non-digital means as well. So we spoke to West Chesterton Mutual Aid and Aegis Thanet about the things they did to ensure that people could access goods and services even if they weren't online. We've mentioned organisations that have started providing devices. We also talk about the role of referral networks and word of mouth that have built up over many years. Now, obviously, that's not something that everyone can just magic out of the air, but it does imply that the benefit of really putting that effort into building those networks whenever you can, so that when a crisis hits, people know where to come to. John mentioned about paper-based information, and we've got examples of Age UK using direct mail, Aegis Thanet using a paper-based directory. And there's also organisations that have contacted people by telephone to ask them about their needs, Lloyds Bank and the Digital Brighton and Hove project. One other important thing to mention when we're talking about digital, it's not just the support for people, but actually the benefits of digital that have accrued to lots of organisations in terms of their internal processes, which have still often involved needing to train staff that might not have had the skills or confidence to use them. So West Chesterton Mutual Aid and Aegis Thanet both talk about the value of collaborative tools like Google Docs, which they haven't been using before for some of their processes. And lastly, Dorset County Council talked about the benefit of making digital champions, people who support people one-to-one with digital skills and building their confidence, to have specialists, people who have the same devices as the learner that they're going to be supporting remotely. That becomes particularly important, that you're looking at the same kind of operating system screen setup. But just to finish, I want to tell you about one of the case studies that's in the report. It's about Michael, who was helped by Digital Brighton and Hove. He heard about the support that was on offer through a letter from the council. A good example of paper-based support. He said he wouldn't have known about the support that was available otherwise. He was shielding at the time, got this letter, was put in touch with the project. They were able to provide him with a laptop, a more suitable device than he had, through a partnership with Tech Takeback, a local refurbishment project. And there's a good example here of the kind of partnership working that's involved in digital inclusion projects. And as a result, he was able to do more on the internet than he could with the previous device that he had, and was very positive about the kind of emotional well-being effects of this, that it was a fantastic freedom. He described it as keeping his life going instead of sitting stagnating while contemplating how the virus was ruining the world. So I'm going to move on now to inviting a couple of our case study organisations, Rebecca from Ageless Planet and Sarah from Age UK, a few questions and get them to tell you a little bit more about their experiences. So Rebecca, perhaps we'll start with you. Can you just tell us a little bit about your organisation, what you were doing in the pandemic and how things changed and how you adapted to the changes?
Sure. So Social Enterprise, I work for Social Enterprise Kent, which is the lead of Ageless Planet, the Ageing Better funded National Lottery Fund program it's now in its 7th year. So prior to the pandemic, we were delivering digital inclusion in a kind of roundabout way. I suppose it wasn't the major part of what we were doing, but we had some sessions that we called BYOD, bring your own device sessions at local cafes. And people would bring along their phone or their laptop or their tablet, and we would have volunteers and members of our staff team there to help support them and help to work out how to use that. So that's kind of what we did pre-pandemic. During pandemic, shall I go into that, James?
Yeah, please do, and how you had to adapt. Yeah.
We had to adapt quite dramatically, as all organisations had to. So the aim of Ageless Planet is working with people who are aged 50 plus, 50 to 100 and whatever. So we went from doing largely face-to-face services. So throughout Ageless Planet, we do several different things. So we have our age-friendly business scheme. We have active citizenship with 115 odd volunteers delivering support, wellbeing support, so activities, all those kinds of wellbeing support activities through with our partners, and all of that had to stop. And we've been telling people for 6 years to get out of your home. We're a social isolation and loneliness program, so it's about interacting with your community, and that all had to stop for obvious reasons. So we went online. We created how-to guides of how to get onto Zoom. We went switched to telephone support, and we also sent out some information manually, which we hadn't really done before. We've got 9,000 odd participants, so that's a very costly thing, but we realized that this was the only way of being able to get to some of the people who are digitally excluded. So we've got this in here too. We've got the age-friendly business directory that we sent out to everybody saying, are you nervous about technology? If so, give us a call. And then we talked through that with people.
Brilliant, thanks Rebecca. I'll come back to you for some more reflections in a second, but Sarah, would you like to introduce yourself and say a bit about how Age UK's experienced this period and the kind of support you've been providing?
Yeah, sure, thank you. So my name's Sarah Parks and I'm a projects manager at Age UK. So Age UK, I sit in the national charity, and then we have a network of over 130 local Age UKs who provide kind of local services to older people in their community. Lots of the network have increased the delivery of their digital inclusion services since COVID, and then we've supported a small number of that network to deliver grant-funded programs in those areas as well, which I can talk a little bit about today. So I guess if we look back at pre-COVID, the main activity that we delivered was a program called One Digital. And through that programme, we established the digital champion model and really grew that across the network that we were working with. We worked with partner organisations, including Citizens Online, to evaluate and learn about the model, and then to share that learning as well. I think it's important to emphasise that that programme was kind of predominantly, I'd say nearly 100% delivered face-to-face with digital champion support. Once One Digital came to an end, we then got some further funding, and we were able to continue delivery of the digital champion model through our most recent programme, Think Digital, and deliver that with some more Age UK partners. This came to a start around March last year, so we had to remodel that to an entirely remote delivery model. So having done that, we made sure that we carried out 2 evaluations from that as well, to really learn about the effectiveness of this model that we didn't know much about, and also the impact of that delivery on the people that we're supporting. A real selling point of that service as well was that we were able to kind of, through the flexibility and adapting the approach of our delivery, we were able to continue offering support when many others within the community weren't able to, and had to either stop altogether or reduce their services. So I won't go through all of the stuff we found from the evaluation, but just a couple of kind of key points from the Think Digital evaluations with the remote model specifically. Is, I guess, first of all, with regards to digital champions, the remote opportunity of being a digital volunteer really worked for some people, but not necessarily for others. And it requires a very specific and different skill set to what we need from face-to-face digital champions. And also those volunteers will rely much more heavily on resources and more specific support to feel confident in their roles as well. They'll also need kind of more support in terms of emotional and skills-based support as well. I think when we're working with older people, as you were speaking about earlier, James, our partners deployed kind of new promotional approaches that we'd never explored before. So we used hard copy leaflets to encourage kind of internal and external referrals. And through some of these new ways, we were actually able to engage with people we wouldn't previously have probably worked with. So, for example, a younger cohort of older people, more in the age ranges of 50 to 60, and older people with more complex needs, and then also older people who are housebound and wouldn't have been able to get to a face-to-face session. I'm just thinking about what's important to say, so when we look at the experience of the older people as well, lots of praises, I guess, for the digital champions, and specifically about their patience and being treated as a human being ultimately as well, and offering that flexible and ongoing support as well if somebody got stuck. So I guess an informal way of that kind of work-based helpline that that case study was referring to. And when we think about the recommendations from that as well, it was found really beneficial that we were able to use the kind of Age UK brand as it's a real trusted brand, and we're able to leverage that moving forward. But it's so important that we have those supporting resources for organisational staff, for digital champions and older people to support the remote interactions. And then secondly, the importance of the devices and connectivity, taking into consideration that those community provisions aren't there anymore. All the devices that people have themselves might be outdated, they might not be working properly, and so it's really important that we're able to provide that. And also finally, in terms of recommendations, we've done this evaluation of the model, but we really need to understand more about some particular underserved groups and how that remote model might work with them and impact people as well. But we've got lots more. We've got 2 evaluations on our website and also a case study video if anyone wants more information on the delivery we've done over the past 12 months.
Yeah, thanks, Sarah. I think the link for some of those things has gone in the chat, and I'll highlight it again when we finish this section. So just thinking about the research itself, it'd be interesting because Sarah, you've talked there a little bit about that the kind of complex things that we found about remote support, that it can be difficult, it can take longer with learners, but it can also enable some learners to access it, not just people who are housebound that you mentioned, but people with caring responsibilities or transport difficulties getting to places, or even just who weren't able to get to a session that might have previously been run once a month at a time that wasn't suitable for them. But it'd be interesting to hear from both of you some more reflections on the experiences of other organisations in the report and the data that we've collected. So, Rebecca, do you have any of those that you'd like to share with us?
So I guess we had to adapt quite a lot, as you're just saying. So we had to show quite a lot of patience. So telephone support was key. So yeah, I think making things available to people in hard copy and community embeddedness, that's a word, was key.
The other thing that you talked about, Rebecca, that I found interesting is the experience of people who were in the age group themselves. You'd relied a lot on peer support for your support, and how that shifted at the point of the pandemic. Obviously, that's something we've talked about in the wider research as well.
Yeah, sure. I think our experience through Ageless Planet is that the volunteers who are in the age group themselves, so 50 plus, helping other people who are 50 plus, we had better outcomes than a younger person coming in and potentially being unintentionally patronising or assuming knowledge or not assuming knowledge. So our experiences were that Ageless Planet participants really responded better to volunteers and digital buddies, as we call them, who are in the same kind of age group, and we're continuing to do that. One of the tricky things was that a lot of those digital buddies were themselves shielding throughout the pandemic, so they weren't able to go out and support people during the pandemic. So we kind of relied a lot on staff team throughout that period. Now, as things are lifting, we've increased our digital volunteers. So we only had about 2 or 3 volunteers who were specifically working on digital. Now we've got around 15, and we've trained them to be and given PPE and all of the appropriate, things and policies, etc., in order to go into people's homes if they need to, because sometimes that's a more appropriate option for getting out and about, and people can't get out to libraries, or as you were saying before, about a certain time at a certain date and a certain venue, that might be still quite difficult for some people. So that's kind of how we've adapted.
So, things that struck you about the research, the report itself, things that you found interesting or surprising in the data?
Was that Sarah, or was that
Sarah? I was saying for Sarah. Yes, sorry.
So I think I've spoken a bit before about how we found through our delivery over the last 12 months that older people coming forward generally were presenting with more complex needs, and I think it was really clear in the research that the group of older people aren't a homogenous group, and there are further divides within the older group. And it's no surprise that the age is the biggest risk factor across kind of all of the aspects, but it's really important to recognise those more detailed divides within the group as well. So lower income people, for example, people on lower income, and also acknowledge that older people who are internet users might be narrow users and still need that support, and be able to adapt the support, I guess, based on the specific needs of those individual groups, whether it's accessibility issues, whether it's specific tasks they need to carry out. So I know we did lots of work with the younger older people who maybe had been made redundant, had to work from home when they previously hadn't had to, and so we actually were supporting people with different activities than we previously had done. And equally, it's really important, I think, to, like you were talking about with the building networks, so working in collaboration with those specialist organisations who might be able to have more knowledge and skills and expertise around, for example, accessibility issues, who can support your digital champions or volunteers, digital buddies, whatever we call them, to be able to deliver that support. I think the really striking thing for me from the research was about the importance of awareness raising and promoting the service. So I think there was a figure in there, forgive me if I've got the figure wrong from memory, but I think 87% of people didn't know who to reach out for help, which is just such a stark figure. And it highlights that the importance of organisations to really increase awareness of what they're doing. I think not just amongst older people, but also people supporting older people. So whether it's their friends, family, other service providers, and this is something that we've been looking at over the last 6 months. So I think we're in quite a good position at Age UK that we don't just support people with digital inclusion, and we have wider conversations that can kind of spark an interest about getting people online, or vice versa. And someone who is being supported with digital inclusion can be supported with another service or referred on to internally. And so I think also those existing relationships with those trusted organisations really provide the opportunity for those interactions. I think the other thing with that, just to mention, is how successful our digital diagnostic tools have been. So this is essentially a survey that is carried out with any new client who comes forward to any Age UK service, and will assess the client's kind of desire to learn digital skills, their need, their existing skills, their access to technology, and then we'll be able to have that initial conversation and refer them on to support if they need to. And that's been really beneficial in us being able to identify people who might benefit from the service. But that obviously relies on a kind of skilled staff cohort, volunteers, who are able to kind of spot the signs of digital need, so that we can really try and kind of make every contact that we have count, with regards to supporting people to get online.
Can I just add to that too, James? Sorry, that one of the recommendations was joined up thinking across voluntary sector organisations and local councils. And I think as an organisation that we tend to bring people together and organisations together across the voluntary sector. I think that's hugely important to avoid duplication, but to make sure that we're able to signpost into different organisations who are working for the same purpose.
Thanks. Yeah. And by the way, just to clarify, that stat that you gave, Sarah, is correct. Of the 500 people that were representative of those aged 50 to 70 on household incomes under 25,000, we found that 87% couldn't identify an organisation that they could go to for digital support or signpost someone that they knew that they needed to. So we're rapidly running out of time, amazingly. So we've got about a quarter of an hour left. I'd like to bring Mark from Lloyd's in just to join us on the panel. As I mentioned, they're another of the organisations that we feature in the case studies. But we'll move over to questions. That I know we've had lots of questions in the chat. So John, you're gonna put some of those questions to us.
Yeah. I'd just like to thank everyone that's contributed amazingly on the chat. There's some fantastic resource sharing. So please continue to do that, and the questions that are coming through. If we don't answer your questions today, we will capture them and answer them as much as we can in a post-event communication. But whilst we wait for Mark, some of the questions that are coming through. One area that's interesting is what help is there for people with disabilities. It'd be really interesting to hear from the panelists and yourself, James, in terms of people that might have hearing or visual loss. Are there any specific resources, organisations, or insights that you have in terms of that section of the population?
Yeah, so there's two ways I'd start to answer this, and I'll come to the others as soon as I can. So the first thing to say is that a lot of organisations will want to signpost people with accessibility needs to a specialist organisation, and that's absolutely going to be appropriate. There's lots of them, some working on specific impairments or disabilities, others that cater to a wide range, like AbilityNet. And AbilityNet have a phone line for digital champion support, and they can go into people's homes and provide assisted technology. There's all sorts of other organisations, but I'll mention them as just one example. But the other aspect is that many organisations will be designing digital platforms themselves, and it's really key that they consider accessibility when they're doing that, so that disabled people with impairments are able to use assistive technology to still access those things. So we've done some work at Citizens Online on introducing to people to the kind of principles of digital accessibility, what kind of things you need to think about. That can be quite complicated, but there's also some really simple things that people should be aware of around color contrast, making sure that websites are responsive design so they work on different devices, making sure that things are keyboard navigable, those sorts of things. The key bit there really to say, because a lot of organizations will be contracting out website design, is to make sure that you mention digital accessibility when you're doing that. Public sector organisations have a legal requirement to do that now, so there's lots of good advice for them that you can refer to as whichever kind of sector your organisation's in. I don't know whether Sarah or Rebecca, you want to add anything on that?
Yeah, I would just add, I think especially with the remote model, it's been really important that we match the right digital champion to the right client or older person, and that matching process works on the interests, availability, but also importantly the specific skills and confidence and needs of the older person and digital champion. So if, for example, somebody is more familiar with specific accessibility barriers or ways in which they can be overcome, then they can be matched to the right person. Also, when we're providing technology, it's really important, even if that's done in collaboration with a local organisation, that devices are pre-configured based on the needs of the person, so that those settings are already kind of established, so that somebody can just pick the device up and get going quite quickly. Also with the hard copy resources, those are so important when it comes to disability and accessibility barriers. We've had some of our local Age UKs and Age Cymru's develop picture-only guides for people for whom English is their second language. And we've got people using video who can lip read as well, which has been a really interesting angle. But those hard copy resources are really vital for that. And also, I just wanted to note that I think it's we need to consider the changing needs of people as well. So the needs that somebody might present with initially might not be the full picture. With regards to accessibility and other factors as well. So it's important to have those check-ins throughout the process of support to make sure that those changing needs are being identified and supported adequately as well.
Thanks, Sarah. I might come to you, Mark, because I know that you, with the phone calls that Lloyd's have been doing, you've encountered people who've had specific needs.
That's right, yeah. Hi all. My name's Mark Tainge. I'm a digital inclusion manager at Lloyd's Banking Group. So I think for us, it's been a really interesting challenge over the past couple of months, adapting to what COVID-19 has brought. What we found is we live in a world that is becoming increasingly reliant on digital technology, and I think the COVID-19 pandemic has only dramatically exacerbated the situation for people, particularly those with poor or non-existent digital skills. What we've been really fortunate and able to do at Lloyd's Banking Group is that we have set up a digital helpline in partnership with We Are Digital. So essentially the purpose of our helpline is to provide free one-to-one training for customers with poor or non-existent digital skills. The service is available to all people over the age of 18. I think what we've really seen is a change in customer behaviour since the start of the pandemic. I think a lot of the people who use the We Are Digital service perhaps wouldn't have seen themselves using internet banking or been online before the pandemic. I think what we've seen is that actually people are now reliant on these digital services, which is why our helpline has been a fantastic opportunity to give people these skills. What we've also found as well is that actually 34% of the people that we have helped had never used the internet before, so we're actually seeing a growing demand in that space. We've also seen that 74% of the people that we help now use the internet daily, and 98.5% of the people that we helped reported an improvement in confidence. So albeit it's been an extremely difficult and challenging situation, it's been fantastic to see the support and the help that we've been able to provide. And today our helpline with We Are Digital, so that partnership started in April 2020. To date, we've supported over 40,000 customers, and we've also been able to gift 1,500 devices, which has been a fantastic lifeline for customers who otherwise wouldn't have been able to access the internet or wouldn't have been able to afford a device themselves.
Thanks, Mark. John, do we want to get another question in, or maybe another couple of questions in before the end?
Yeah, that'd be fantastic. A couple of questions that are coming through from the Q&A. If panelists can answer them relatively briefly. One was on, well, it's a big issue, affordability. Poverty is the issue. That's what people are saying, its root cause. What assistance is there in terms of affordability schemes or resources people could be pointed to? Because this is going to be an ongoing challenge, you know, with or without the pandemic. What's your views?
Shall I have a go?
Yeah, go ahead.
Oh, no, you go. I was just going to say we work really closely with Citizens Advice, and Citizens Advice, Thanet, have been supporting people to maximise their own income. So I think since March 2020, they've kind of maximised £220,000 worth of income for individuals. So that is one way. Another way is device recycling centres where you can get device, but I think it's also about that Wi-Fi, and a lot of the people that we work with can access a device. That's not too much of an issue. It's the Wi-Fi that's the main affordability issue. So I don't have a particular answer to that, other than that we help in the initial kind of stages. It's a difficult one. James, you might have some more insight on that.
Yeah, I'll offer some quick thoughts. I mean, this could be the subject of a whole webinar just by itself, and there are organisations looking at it in that detail. There are some schemes that different providers have. So BT have a broadband scheme that's a lower offer if you're on certain benefits. Virgin have a similar scheme for universal credit, and other providers are either introducing them or may do in the near future. That's on affordability of data. On devices, we've got some stuff in the report about Nominet's reboot scheme and their advice for projects that want to set those up, and we provide advice around tablet schemes ourselves as well. I think the way that you phrase that question, John, kind of hints at one aspect of it, which is that obviously if we do stuff about this in terms of digital, looking at the costs of data, you could have there's campaigning and lobbying around that. You've got the cost of devices. But there's also just this broader question of the income that people have. And Rebecca's talking about one aspect of that, helping people to understand what benefits are available to them and help them navigate potentially digital by default schemes. But there's also something where, we can just look at addressing that wider issue. If people are having to use food banks, they're obviously going to be seeing digital as lower down the order. So unless you solve that problem in terms of poverty generally, it's going to be much more difficult. We can't just look at it for just digital alone, I think. Should we do another question, John?
Yeah, very brief, very briefly. As to all of you, in terms of how do you measure success with your digital inclusion campaigns and activity? What are some of your key metrics?
Oh, that's a good one. Sarah, you've just done this evaluation report on Think Digital, and we'll be sharing the link for that. So do you want to talk a little bit about your success metrics you used there?
Yeah, so in terms, we deliver really flexible support. So it's not a 6-week course that somebody comes on and kind of we have people enrolled for that period. So we measure on a quantitative side, we measure the number of people that we're supporting, the number of sessions that each digital champion and number of clients that they're supporting, and how that ongoing support looks, what that ongoing support looks like. Within those sessions, we also look at what topics have been covered based on the essential digital skills, and also any further learning needs. On a kind of actual session-based level, we will identify goals with an older person, and those will be kind of evaluated throughout the process so that we can make sure that the support is supporting them to achieve those goals. And then from a kind of more qualitative side of things, we really look at the first evaluation. We looked at how accessible the service was in terms of all of the elements of project delivery, and the impact that it had on people achieving those goals. And the second evaluation looked at the longer term impact. So once somebody has stopped either momentarily or permanently for the time being accessing the support, what impact does it have on their day-to-day lives 4, 6, 8 weeks later? And we found some really interesting findings from that as well. So I think there's lots you can capture initially at the point of kind of interaction, but there's so much learning to gather across the longer term span of somebody's engagement and beyond as well.
Thanks, Sarah. Should we get quick responses to that from you, Mark, and then Rebecca, I'll come to you.
Yeah, no, that's fine. So for us, measuring success, I suppose, is about the number of customers that we're able to help, but also measuring the improved confidence that those people have as a result of being referred to the We Are Digital helpline. For us, our partnership is not necessarily about just supporting the customer with banking needs. It is that societal aspect as well. A lot of what we give through the helpline is supporting customers with video calling family and friends, booking GP appointments online, doing online food shops. So it's making sure that the customer is confident online and actually sees the internet as a multi-purpose tool. So for us, having a percentage of 98.5% on improved confidence after they've been referred is fantastic. And we're doing some work internally to have a look at how that's then changed the customer's behaviour post-referral as well. But for us, what we've seen so far has been hugely successful.
Thanks, Mark. Rebecca?
I don't have a lot to add to that. But, we do some of those things. I guess our success is some more of the things that Sarah mentioned, but also if people are then attending a Zoom call with us in the future and we say, okay, cool, job here is almost done, but you know, are you also doing the things that what's in it for me factor? Are you looking at Zoom? Are you going on to the shipping forecast? Are you going on to bingo with your friends? Are you using Scrabble and all the different amazing different things that you can do online? And I think that success for us is all of those stories that we hear from our participants.
And you've got a lovely video, Rebecca, which we'll point people to, which kind of showcases that range of things that you've been supporting people to get engaged with. I just really briefly just say for us, I mean, there's lots of ways you can measure, you can count lots of things, but one thing that's really nice about the report is we get those deeper case studies. It's been really interesting to me to hear the wider things that people say about what's good for them about being online. It's really hard to capture that in a short evaluation. It's hard for me to explain what I get out of it. It's hard for me to explain the nuances of the negatives and the positives, but it's really great to do those case studies to hear those stories from people. So I'll share my screen again, and I should be able to just take you through those last three resources. Age UK have got making the most of the internet resources that they're using to help people help others to develop their digital skills and confidence, and the Think Digital evaluation that Sarah's mentioned, which are both available from their website ageuk.org.uk. And Rebecca at Ageless Planet, I've just mentioned that short video on the breadth of activities, and also they've got an event of their own on the digital inclusion work they've been doing, if you'd like to hear more, on the 11th of August, and you can find information about both of those at agelessplanet.org. Shall I do this bit as well, John?
I will come in at this moment. Thank you so much, James. Thank you so much, panelists. Thank you so much, Mark. We've slightly run over time, but it's been a fantastic discussion this morning. Really, really good to connect with all of you. Thank you for sharing your resources and the chat in chat, and thank you for sharing your questions. This is probably the busiest set of questions that we've ever had. So we will be, as I said, doing some post-event comms to you. Please complete the feedback form that you will have seen just in the chat there if you have a little bit more time. Really love to get your views on this morning. We tried to really push as much as we could. I said, point you to the website. So this slide obviously shows our website area in terms of Aging Better, the publications, in particular the COVID-19 and Digital Divide and Digital Skills to Connect. So the shorter report is the COVID-19 and Digital Divide. The wider, more in-depth report is Digital Skills to Connect. So please go onto the website and download those if you already haven't done. Share those with your colleagues. I'm aware that only a small proportion of people could come today. Just wanted to finally say that the next Aging Better webinar will be on the 15th of July, and it's looking at our new research and how we can better meet the needs of older adults through inclusive design. So a link in the chat and details are also available on our website. But a bit more on digital, we're going to host a digital connectivity webinar in mid-August relating to the home. We're doing a good home inquiry, which is a tremendously important inquiry in looking at non-decent housing, and digital connectivity is a crucial part of that. So we're hosting a webinar in mid-August, and there'll be more details on the website for that. So all I'll say is, again, thank you for your participation today. We will be in contact with you. Please go to our website to get more information and download any material. Please connect with us if you have any issues or questions. I hope you found this morning useful. We found it a tremendous sort of dialogue, and we'd like this to be the start of an ongoing dialogue and ways in which we connect with you all. But from me and from the panelists, I'd just like to say thank you.